Okay, the first people are going to have speak to us, just getting things started here, are from the Transplant Research Foundation. So we have Christy Caldwell, who's the Senior Advisor for Transplant Research Advocacy at Transplant Research Foundation of BC, and Lori Lothian, the co-chair of the same. So I'll let you guys take over. I don't know if you have slides or not, but
yes, we do.
So it's, yep, so lean forward, read that.
Perfect. Yes, we do. Welcome back, everyone, and thank you for being here. In addition to myself, Lori, co-chair, and Christy, our senior advisor, we have Rachel Dury, our co-chair, sitting at the back of the room directing. And I hope over the next couple of days you have the opportunity to meet all of us at our booth, and we'll look forward to talking a bit to you there. We are grateful for the opportunity to gather on these traditional lands. And we're very grateful to BC Transplant also for the opportunity to introduce ourselves to you and hopefully tell you a little bit about how we can support you and your ideas in working to make lives better for transplant patients. Transplant's not a cure, and I don't need to tell any of you that. The slide is here because it really underscores the mission and vision of the foundation. Our vision is that one day there will be no waiting lists for transplant, and transplant will be a cure. And we're not there yet, but we believe that research is research is the path forward. So who are we? Well, it's a little known fact that we started life actually as the BC Transplant Research Foundation back in the 90s. And it was the brainchild of Bill Barables, who was the longtime director of the then agency. And Bill saw that there was a real gap in funding, that it was a talented research community, great ideas, but you can't go to CHRI with a great idea. You need proof of concept. And so we started the Research Foundation and began to fund these innovative, new, great ideas through to proof of concept stage. That is work we do to this very day. Now, some things have changed along the way. In 2009, we became a standalone foundation. We've always been a charitable foundation, but now 100% of the funding we're able to do for research is made possible through donations from the transplant community and the public. We like to think of ourselves as small but mighty. We have some really great partnerships with VGH and UBC Hospital Foundation and Vancouver Coast Health Research Institute that allow us to stay focused on our mission and to keep our cost low and funding high. And we're operated by a volunteer board of directors. And Christy as our one part-time employee. You'll see lots of familiar faces there. We share, all of us, a connection to transplant and a passion for research. So how do we do what we do? We have evolved over the years to have 4 streams of funding. And we're going to talk about each one of these programs today and tomorrow. So I won't get into that, but what I want to say to you here is, if you have an idea, if you have a question, if you want to do research, you will find support and funding for that somewhere within these programs. One more thing before Christy talks about the work, and that's patient-oriented research. That, of course, is the idea that patients belong in research, not just as subjects, but as partners. And it's one of our core values. We've worked hard to bring it into transplant research. We do that two ways. We have education workshops for both researchers and patients. We have a great team of patient partners all trained up and working now on research in BC. And I would say to any of you, if in your work and your practice, you come across patients who you think would be keen on contributing in that way, please put them in contact with us. The other way we support this is to require that every one of our projects has a robust patient engagement plan as part of it. And with that, I'll ask Christy to talk about the programs.
Great. Thanks, Lori, and hello, everyone. Hope you're doing okay after the post-lunch. So now you've heard a little bit more about our history and who we are as an organization, but I would like to delve a little more into the work that we actually do. So that is our funding programs and specific grant opportunities. And one of these being the Research Challenge Program. And this was a partnership that we entered into with Vancouver Coastal Health Research Institute and Providence Healthcare Research Institute back in 2016. And so this is a program that really focuses on newer and beginner researchers. And it's a chance for them to really develop and to learn those basic research skills with the ongoing support of a more seasoned mentor. And so for us, this was a win-win because here we were, we had the opportunity to greatly expand our research efforts to include allied healthcare professionals, all the while continuing to help build research capacity at two of the major transplant centers in our province. And so through this program, every year we commit to fund 1 to 2 of these micro grants. So that's these small $5,000 to $10,000 grants, 1 to 2 each at Vancouver Coastal Health and 1 to 2 each at Providence Healthcare. And I'll just bring your attention to the fact here that the BCHRI competition has already launched with LOIs due November 6th, and Providence dates have yet to be released, but you can anticipate those for also early in the new year. And I just wanted to highlight, you'll see on each of our project slides that we're speaking to, that there's a QR code. And that is there for you to go to our website to learn more about these individual programs. And you can learn more about the eligibility, the requirements, as well as some of the work that we have funded through these competitions. And so to that end, here we actually have some of the projects that we've been able to fund. And this is really just a small snapshot of the work that we have supported over the years. And I'm sure you'll recognize some familiar faces, but the main piece around this is even though these are really diverse and dynamic projects, they really do encompass a wide array of organs and ideas and teams and programs. So here, of course, we have Jody and we have Christina, who are social workers. Then we have Cindy, who is a pharmacist, and Josie, who is a patient educator and a nurse. And despite these projects being very wide in scope, they all have the one thing in common, and that's that they asked a practice-based question that was relevant to patients, families, as well as the healthcare system related to organ donation and transplantation. And so building on the successes of this partnership we expanded the collaboration to include the Team Grant program. So the Team Grant Award is focused more on health, community-based, as well as patient-oriented research. And for us as an organization, we were really excited because this was an opportunity where we could really expand to embrace a more robust patient-oriented research approach to the work that we were doing and the work we were funding. It was also an opportunity to more readily align our projects with patient-identified research priorities. And these were priorities that had been previously developed by the Canadian Donation and Transplant Research Program, the CDTRP. So every year, TRF commits to fund 1 team grant each at Providence Healthcare and Vancouver Coastal Health. And these are $30,000 in scope. So just to note here that the competition is now live. VCH and PHC, they run that competition in unison. And so the LOIs will be due November 6th, full applications due February 12th. So you have time, it's just the LOI stage. So if you have those ideas either for the research challenge or the team grant, again, check out the QR code where you can learn more information. We would really love to be able to fund 2 exciting team grants this year. And in line with that, here are some of those exciting grants that we've been able to co-fund over the years. And here you'll see a real diversity in projects. But again, what you have here are individuals who are asking and addressing areas of practice that really matter to patients, families, and the healthcare system when it comes to organ donation and transplantation. And if you want to learn more and check out more of those projects, please visit those QR codes or come and visit us, of course, at our booth, where we are happy to talk to you more about any one of these programs. And tomorrow we will be touching more on those seed funding opportunities. So this was more of those practice-based research opportunities. But I'll hand it back over to Lori to help wrap up.
Thanks, Christy. Measuring success and impact is always tricky with research foundations, I think. There's traditional metrics, and I keep pointing to the slide over here, and we're proud of those. But we're also very proud of the fact that to date, we have managed to fund every project that has come to us as recommended for funding. And that is super important because to us, every research project is by definition a success. There is a question, there will be an answer. And maybe this particular idea pans out, or maybe it doesn't. But no matter what, that knowledge is paving the way, piece by piece by piece. It is moving us to the place where transplant will be a cure. And usually along the way, very much improving the lives and outcomes of transplant patients. And we're grateful for that. I would invite you to connect with us if you haven't already. We are active on social media. Our website's here. And I would like to say that Christy writes a really wonderful blog that profiles patients and researchers in our community, and it's really worth subscribing to. I'm not sure if we have time for questions today. We will be, as we said, at our booth, and we'll be presenting tomorrow and talking more about the research challenge the
Venture grant.
the venture grants and the Addison Pediatric Fund. So thank you very much for your time and attention.
Thanks, everyone.